Good morning. My name is Dr. Kathleen Kendall-Tackett, and today I'm going to talk to you about the impact of trauma on health. So what I'm going to do is actually just give you an overview of trauma and health. Now, if you'll go to some of my other modules, we'll go into more detail about some of the mechanisms that are involved. But first I want to start off by just talking to you a little bit about how trauma can impact health. Okay, so anytime when we talk about the effects of trauma on health, it's very important to mention one really important study, and that is the Adverse Childhood Experiences Study. Now, the Adverse Childhood Experience Study, or ACE study as it's known, kind of in the field, is a study of 17,000 patients in the Kaiser Permanente healthcare system in San Diego, California. Now, what was interesting about the ACE study is it was the first study that actually showed that childhood abuse or adverse childhood experiences actually could have an impact on organic adult health conditions. And so again, prior to that, whenever we talked about, the impact of childhood abuse and we started looking at some of the physical health problems, the earlier studies were on things like irritable bowel syndrome, fibromyalgia, some of the chronic pain conditions that we call, for sort of want of a more better term, functional illnesses. Now basically what that means is that there are no easy ways to sort of document the physical health aspects of those conditions. So they tend to be what we call diagnosis of exclusion. So you diagnose that after you've sort of ruled out all the other sort of physical causes. Well, so prior to the ACE study, we mainly had IBS, we had fibromyalgia, and some people actually, really consider those illnesses almost more psychiatric. And so again, it was kind of going back to what we originally used to think, is, we'd look at the impact of things like trauma, and we'd really look at how it impacted sort of mental health, but not physical health. Now, the ACE study actually changed all of that because it was the first that really linked childhood abuse to adult organic disease. So all of a sudden they were looking at things like cancer and emphysema and these other kind of conditions that you really couldn't argue were psychiatric illnesses. Okay, so let's talk a little bit about what ACEs are. Now, the first ACE that, of course, came up in the researcher's mind, and the two researchers on this study were Robert Anda from the Centers for Disease Control and Vince Felitti from the Kaiser Permanente healthcare system. And Vince was actually the one who really looked at the impact of ACEs first, and he started actually with child sexual abuse. And again, part of it just came from his own background of working in a program, for women with morbid obesity, so women who had very high BMIs, and discovering that a certain subgroup of those women, who were not losing weight, all of them actually had a background or a history of childhood sexual abuse. And the way that Vince tells the story about this is he said that nothing in his training as a physician prepared him to find that. But he was curious enough that he kind of, asked good questions, and then that led to, eventually them doing the Adverse Childhood Experiences Study. So child sexual abuse was the first one that kind of came on the radar. But what they discovered actually is that you can't just look at child sexual abuse. You have to look at other types of maltreatment or adverse childhood experiences that children experienced if you're going to look at health problems. Okay, so the next one they looked at was child physical abuse. Okay, of course, and also a very unfortunately common type of child maltreatment. And child emotional abuse. And this one is actually very difficult to measure. As a researcher, I can just tell you that this can be really tough to measure. But oftentimes, the emotional abuse effects are the ones that people remember the most. It's kind of like, for example, being physically or sexually abused and then being blamed for it. And oftentimes, the things that people say tend to actually be, the lingering kind of things that impact people long past, when the abuse is over. Okay, also, children who witness their parents being violent, so witnessing intimate partner violence. What researchers actually have discovered is that these children often show signs of abuse, even if they've never been abused themselves. And so again, that's one of those other kinds of things. And what you really can kind of see too is oftentimes, if there's, some kind of severe dysfunction in the family, there's multiple types of it. It's not just one type. Okay, also, are the parents abusing substances? Are they engaged in criminal activity? Or do they have a mental illness? And that includes depression. And again, like I said, we actually really have a pretty large literature on the impact of things like parental depression on children. And again, like I said, lots of things sort of modify those effects. It's not to say that, anytime somebody's depressed, there's going to be these lifelong health things. But we do know that that actually does have an impact. Okay, and the final variable they looked at was parental divorce. And this was particularly true if the child didn't see the non-custodial parent anymore. Okay, so then the next question you probably want to ask is, well, how common are these? Now, in the ACE study, in the original paper, 50% of their population of 17,000 patients reported at least one type of ACE. Okay, and again, the more types of these that somebody reported, the worse their health tended to be. Okay, so again, you saw in a pretty middle-class sample that these were actually pretty common experiences. Okay, a question sometimes people ask me is, well, based on kind of a more recent sample, how common are these experiences? Well, this was actually a study that we did a couple of years ago. And it was based on 6,410 new mothers. So to be in the study, you just had to have a baby 0 to 12 months old. We had women participate from 59 different countries around the world. And what was interesting is this was actually a largely middle-class sample. When you looked at it in terms of education. Now, when you looked at it in terms of income for the U.S. sample, we had a pretty good spread. But in terms of education, 73% of the sample had a bachelor's degree or higher. Now, generally speaking, we would consider this a fairly low-risk sample. And what we kind of discover is how common these types of adverse childhood experiences are. Okay, so these are some of the questions that we asked. How often were they hit or slapped hard enough to leave a mark? Keyword being here is often, 34% reported that. We had a very high rate of sexual assault. Okay, so the most serious type of either sexual abuse, or we specifically asked about rape as a teen or adult. 13% or 994 women reported that. When you looked at all types of contact child sexual abuse, we were at 25%, which is exactly what the literature would suggest. 36% reported that their parent was depressed. 16% reported that their parent was hit, bitten, or kicked. And again, remember, this is a pretty severe level of partner violence. And 32% reported that their parents were abusing substances. Okay, now alcohol, of all the substances, alcohol was the most common. But again, given the type of sample that we had, I expected that prescription drugs would be the second most. And in fact, that's not what we found. We found actually that street drugs were. Prescription were kind of the distant third. Okay, so you actually see, there's a lot of things going on in the sample. And, we will come back and talk a little bit more about what we found. But let's go back to the ACE study. Now, in the original paper published in 1998, this was the statement that they made. And again, it shows you one of the reasons why this was such a groundbreaking study. They said that adverse childhood experiences are related to the leading causes of premature mortality and preventable death in adults. And so again, you can see we've moved way beyond looking at things like functional illnesses. Because, in terms of an outcome, you can't get much harder than death. Okay, so again, this is a very, very key study for that and showing, these organic illnesses. Okay, so again, like I said, the more types of adverse childhood experiences that these patients had experienced, the worse their health tended to be. And so they looked at a group of patients who had experienced 4 or more types. Now, that's not incidence, that's different types of ACEs. Okay, and they had higher rates of things like ischemic heart disease, cancer, stroke, chronic bronchitis, emphysema, diabetes, skeletal fractures, and hepatitis. And so again, very serious illnesses and all related to childhood abuse. Now, another large study that looked at this was the National Comorbidity Survey. Now, what's interesting about this data is that they actually found these effects for women, but not for men. And we've actually seen that fairly consistently across different studies. We're not really sure why the sex difference is there, but we do see that. Okay, but what's interesting to notice, if women had a history of child maltreatment, okay, so that includes both abuse and neglect, they had a 9-fold increase in the risk for cardiovascular disease. So again, that's a very significant kind of finding. And so, one of the questions that people kind of ask is why? What are the mechanisms for that? Well, one of the studies that can kind of give us a little bit of an insight is looking at this one. This is the Dunedin Multidisciplinary Health and Development Study. Now, this was what's known as a birth cohort study. So in other words, they enroll everybody that was born a certain year. And this was from this town on the South Island of New Zealand called Dunedin. And what they basically did is they enrolled them at birth, and they've just been following them ever since. Now, the last paper, the most recent paper I've seen cited from this was actually at the 32-year mark. I'm sure they're actually beyond that at this point. Okay, now what was interesting is at the 20-year mark, they found that the men and women who had a history of child maltreatment, now remember they've been following them since birth, they had a higher rate of C-reactive protein 20 years later. Now, C-reactive protein is an inflammatory marker, and one of the things that we know is that it's actually a risk marker for heart disease. Okay, so in fact, we're starting to see more and more physicians actually use this in kind of workups because it's a good screening. It's one of those things that tends to kind of show up in lab findings. It can be done as part of a normal primary care workup. and you can actually see that it does increase the risk of cardiovascular disease, or actually we see that in other studies. But you can see that it's actually in this study related to a history of child maltreatment. Okay, now they also found in this sample that if the men and women who participated in this study had a history of maltreatment, they also had a higher white blood cell count, and they also had a high level of fibrinogen. Now, fibrinogen is also concerning because one of the things it does is aid in clotting. So basically, you're seeing a history of child maltreatment being related to sticky blood 20 years later. Okay, and they also found, too, that the more severe the abuse, the higher the level of inflammation. So it's what we call a dose-response effect. The more, again, I said the more severity was related to the higher level of inflammation. Okay, now looking at a paper from the 32-year mark from this study, what's interesting to note is to take a look at these kind of risk factors. Now again, they kind of analyzed this data in a little different way. And what they actually looked at is they also looked at what they called adverse childhood experiences, but they defined them a little bit differently than the ACE study did. Okay, so they included low socioeconomic status, a history of maltreatment, and social isolation. Those three is what they considered to be adverse childhood experiences. And what's interesting to note is take a look at how these kind of risk factors kind of overlap with each other. Okay, so the men and women who scored high for their definition of adverse childhood experiences were more likely to have major depression. Okay, they were more likely to have systemic inflammation. Okay, and I will tell you that actually both of those are risk factors for cardiovascular disease. And they were more likely to have 3 markers of metabolic syndrome. Okay, so again, all 3 risk factors specifically related to a history of child maltreatment. Now, another study published in the Journal of Child Abuse and Neglect actually took a look at kind of something you wouldn't necessarily probably put together right away, and that is the relationship between depression and obesity. Because again, a lot of times we think of obesity as being kind of strictly behavioral. It's diet, it's exercise. We don't necessarily think of some of the mental health aspects of it. But this study actually found too that a history of both physical and sexual abuse doubled the odds of both depression and obesity. Now, where we really actually are starting to pay a lot of attention is the impact of things like history of child maltreatment, on the development of the next generation. So we're looking at these variables in terms of how it impacts women during pregnancy. Okay, and what was interesting is we're starting to see some very important differences based on ethnicity. Okay, and so again, in this sample from Julia Sang, you can see that she compared, a sample of about 800 Caucasian women with about 709 black women, and found actually that the black women had more trauma exposure. Okay, so they're already coming into pregnancy with more trauma exposure. They had more PTSD symptoms and diagnosis, and more depression and anxiety. Now here's the scary thing. All of those things we know increase the risk of preterm birth. Okay, preterm birth is actually the #1 killer, according to the World Health Organization, of infants. It's the #1 cause of infant mortality. And when we start talking about things like ethnic disparities in infant mortality, this is a really important thing. And so here we see trauma being related to this very important indices of health. Okay, and we also see when you look at the rates of PTSD, okay, for whites versus blacks among this sample of pregnant women, 24% reported a history of PTSD, full criteria PTSD, compared to 17% for the non-black. Okay, and when you looked at current prevalence, it was even more shocking. 13% for the black versus 3.5 for the non-black women. Okay, so again, you think about PTSD actually and its impact on the sort of prenatal environment, and the fact that we know that it is actually related to a shorter gestation and lower birth weight. Okay, and all of a sudden you start getting some mechanisms for explaining some of the the huge ethnic disparities that we have. Okay, and again, trauma turns out to be one of the key findings. Okay, and also we found that a history of child abuse was significant as a risk factor for both groups in terms of these high levels of PTSD. Okay, now as I mentioned, this is another study from Julia Sang, and she actually again looked at 3 different groups of first-time pregnant women. Okay, so she had a group of 255 who were positive for PTSD. She had 307 who were trauma exposed, but she identified them as resilient. They did not have PTSD. And then you have the non-trauma exposed women. Okay, and finding that PTSD was related to both lower birth weight and shorter gestation. Okay, so again, as I said, when you start looking at things like low birth weight and short gestation or preterm birth, Remember, World Health Organization has identified this as the #1 cause of infant mortality in the world. Okay, so what she found is that child abuse and neglect, okay, so again, that history of childhood trauma accounted for 56% of the PTSD during pregnancy. Okay, and that in fact, PTSD subsequent to child abuse was the thing most strongly related to the adverse outcomes. Okay, and they noted, in fact, that it was not the abuse per se that increased the risk of preterm birth, but in fact the PTSD that was subsequent to the abuse. So again, one of the things that's very important, particularly when you start talking about pregnant women, is this really, I think, underscores the importance of doing prenatal screening for both depression and post-traumatic stress disorder. Okay, so with that, I'm going to actually wrap up this module. I would like to invite any of you who are interested in kind of following some of the work that I do to come follow me on Facebook. This is my Kathleen Kendall-Tackett page. And if you're interested, these are my websites. And so if you want to know more about trauma and health, I would particularly point you to the Uppity Science Chick site. That's actually where I have most of my research on trauma and health. So thank you, and I'll see you next time.